Hi, today I wanted to talk to you about meniscal tear. What is meniscus? Meniscus are those C-shaped horseshoe-like structure that sit in your knees. You actually have two of them in each knee. You have the one inside your knee and outside of your knee. So what functions do the menisci or meniscus serves? Number one, they serve as a shock absorber. And particularly when you're running, jumping, it helps to distribute the forces evenly in your knee. They also provide structures and stability between femur and the tibia. They also help distribute the lubrication or the synovial fluid of the knee joint. I call it the WD-40 of your knee. And they also have nerve endings that sends signals to your brain, letting the brain know the position of your body. This is called the proprioception. So they serve very important roles. So what are some of the most common causes of meniscal tear? Sports injury probably tops it. Twisting, sudden stops, or direct turns, or contact sports such as football and soccer can end up damaging your meniscus. I have a lot of senior patients who come in and say that they hurt their knees when they were younger playing some kind of sports. Age-related degeneration also can weaken the meniscus and thins it as we get older. Twisting while you're lifting heavy objects can also tear the meniscus. Traumas such as direct impact, direct blow to the knees while you're playing contact sports. Repetitive stress. Some of you may have an occupation that requires you to regularly bend, squat, or lift at your job as well. Carpenter or carpenting is one of the professions of the people that we come in with a lot of knee injury. And carrying excessive weight over the years can also cause you to have meniscal damage as well. So there are 6 types of meniscal tears, and it all depends on the shape of the tear and where it is. And radiologists can be very creative. So we have names like bucket handle tear or parrot beak, but they all really depends on the shape of the tear and where they're located. So let's say that you've been just diagnosed with a meniscal tear, your knee's hurting, you've hurt your knee. What are some of the treatment options? If you notice a visible swelling, redness, and pain in your knee, you can use what's called the RICE method, and that is short for rest, ice, compression, and elevate that part of the knee to help with the swelling. You can also medicate yourself using over-the-counter medicine such as Advil or ibuprofen or Tylenol, which I am not a fan of. You can also go through a series of physical therapies to strengthen that knee. You could also wear brace to support that instability of the knee as well too. Some of the medical interventions, your doctor may recommend corticosteroid injection, or if none of these work, you may be recommended arthroscopic knee surgery that removes the meniscus surgically as well. I wanted to talk about the steroid injection or the corticosteroid injection. What it does is it's anti-inflammatory and can give you a very quick pain relief, but the pain almost always comes back, and the subsequent injections don't last very much. So we have a lot of patients who says that the first one worked great, I was pain-free for 6-7 months, but the pain came back, and the second one I got didn't even help me for a couple of weeks. There are more than a couple of interesting research studies that came out on steroid injection. So one is a randomized trial of the study where they followed over 4,796 patients aged between 45 and 79 years old. And they concluded that with a corticosteroid injection, injection was significantly associated with a post-injection progression or arthritis in the MRI finding. Another study that was done was actually done on over 6,000 patients. This is a 4-year study where they concluded that steroid injection accelerated the radiographic progression of osteoarthritis, especially in the medial joint narrowing. So what it says is that steroid injection was associated with making arthritis happen faster in that joint. Now, secondly, the meniscal surgery. Typically, the surgeon will remove the torn or damaged part of the meniscus. Partial removal is more common because it is better for the patient to keep that meniscus in there. They're typically done arthroscopically with a minimally invasive procedure using a small camera to remove that part of the torn meniscus. Torn meniscus can also be repaired or stitched to preserve the meniscus as much as possible. So here are some of the research findings on arthroscopic knee surgery. It has a relatively quick recovery time, but it decreases the function of the meniscus. I mean, you have just removed parts of that cushion that your knees are supposed to have. Studies have also found that they're not really helpful in reducing the knee pain, and the uneven distribution of the weight increases the arthritis progression. It also increases the likelihood of knee replacement surgery in the future. So I really recommend patients to consider some of the regenerative options. One of the regenerative treatment that we use in our office frequently is called platelet-rich plasma therapy, where we draw out a couple of tubes of the patient's own blood and we harvest the rich plasma from it. And platelet-rich plasma injection has a lot of study that backs up its efficacy and its benefit with minimum side effect for the patients. So there is a German and Swiss study where 60% of the patients showed a significant improvement in their pain and function. A Pakistan study that concluded that there was a considerable improvement in 3 and 6 month outcome. And a French study that says all 6 participants were able to recover from competing or training from the sports, and the 6-month follow-up showed no further degeneration. Some of the other regenerative options you should consider is a stem cell therapy using your own fat cells. Your fat cells actually contain some stem cells in it that we can harvest to use to treat degenerative condition. You can also use stem cells from your bone marrow as well, or you can also use perinatal tissues such as amniotic fluid and umbilical cord tissues. There are 4 movements that I have put together for my senior patients to do to strengthen the knee joints, and those things include walking backwards, anterior tibialis exercise, squatting, and doing this movement with having your knee flossed. And I actually did a workshop a couple of months ago, and I'll post a link below for you to check it out.